Dr. Supe, Dr. Pandya, Dr. Mehta, Madam Kirtane, who gave us a beautiful documentary on a remarkable woman who first became a doctor in Pennsylvania, faculty members, friends and colleagues, some of them I see sitting in front of me, students, ladies and gentlemen. At the first, let me thank Dr. Supe for inviting me here to be the chief guest at this function. It is a remarkable thing that you have done to set up a Department of Humanities. I would prefer to call it humanities rather than medical humanities. It is really a very important aspect which has been missed out in not only this city, in our country. Just for your information, the first Department of History and including humanities in the United States was set up in 1929 by William Osler, when he realized the impoverishment of students following the domination of science. And also, the mentor after him fell to the great surgeon Harvey Cushing. I don't think there are, except perhaps for St. John's in Bangalore, I don't think there are any other schools of medicine which have this particular department. And I'm so happy that it is in the name of a doctor who was a teacher, who was an academician, and a writer, and one who was so beloved by the students. My proposition today is that the awareness and particularly an acquaintance, if not a deep study of the humanities, makes a better physician. When I say physician, I mean all doctors practicing medicine in all fields of medicine. And what exactly do we mean by humanities? Well, it includes history, it includes ethics, it includes literature, poetry, philosophy, religion, perhaps social sciences, art and culture, the visual arts, poetry, drama, and even cinema. The last time I was here, some months ago, I gave a short talk on ethics, and I do not propose to repeat that today. But I do know that it's an extremely important subject which is going to occupy the attention of this department, both with relation to debate and discussion, for the simple reason that the ethics in medicine, not only in this city but in this country, is deplorably low. Being such an important subject, I, however, have to make just a few remarks. The first is that medical ethics is really just a branch of general ethics, and it would be wrong to divorce the ethics of medicine from the ethics of everyday living. There's a beautiful definition of pithy, small, excellent definition that I have found on ethics. It's by a Professor Dunstan, when he says that ethics is the obligations of a moral nature that govern the practice of medicine. I think that pithily sums up what ethics is all about. I'm not going to speak about it, but I want to give 3 simple, basic dictums to students here who are to go out into the world to practice medicine. The first is that if you value money more than your own profession, you will fall by the wayside. If you value the acquisition of power in medicine for selfish reasons, for aggrandizement, you will also fall by the wayside as far as ethics is concerned. But if you make your profession the very center of your being and your existence, and if you truly care for people or patients who trust you and come to you for help, I'm sure you will be able to tread the straight and narrow path. I propose today to speak a little on the history of medicine in general. There is no greater saga in the history of man than the epic of medicine. The romance of medicine consists of the dynamic cavalcade of great men and women, of heroes and impostors, of the caring and uncaring who have shaped the path of medicine. Some of you students will be surprised to know that the roots of medicine lie in magic. The shaman, the ancient shaman at the dawn of civilization, who exorcised the various evil spirits that gained into the body and wrought havoc both in the mind and the body. He exorcised them by fair means and foul. And then came religion, so that you have a combination of religion and magic. And I must introduce at this point, to the students particularly, the name of the first great physician recorded in history. From the mists of antiquity, 2,700 years before the birth of Christ, there came a physician recorded in history, in Egyptian history, and his name was Imhotep. When translated, it means he who comes in peace. He was the priest-physician to the pharaoh Zosa. And he must have been a remarkable man, but this is what is actually recorded. He was a great architect. He was a great astronomer. He was a scribe. He was a scholar. But above all, he was a great physician. Can you believe it? The first step pyramid, Saqqara, in Egypt was built by Imhotep. The flutes and the vaults and the bas-reliefs that characterize Egyptian architecture come from him. And they have remained the emblems of Egyptian architecture for a millennia. But as I said, most of all, above all, he was a kind, humane, compassionate, wise, knowledgeable physician. And it is said that when he died, and when his funeral barge went floating down the Nile, the people of Egypt lined the banks and wept. That indeed was the physician. Well, you have magic, you have religion, and then came empirical medicine. And following empirical medicine came science. And today, all medicine is a mixture of empiricism and science. All fields of medicine are a mixture of empiricism and science. Before I go further, I would like now to introduce the great traditional medicine that existed in India so many years ago. Ayurveda. Veda is knowledge and Ayur is long life. It is the wisdom or the knowledge of long life. I'm not going to, and as you all, I'm sure, know, the two pillars that support Ayurveda is the compendium of Charaka and Susruta. Charaka Samhita and Susruta Samhita. They were historical great figures. I'm not going to talk about them. What I'm going to talk about them is you should know when and where Ayurveda started. Modern research, and there is a man called Zisk who has written a nice book on this, has shown that Ayurveda started in the aesthetic milieu of the Buddhist period in the 5th and 6th century BC. I feel that it must have come even before that, because our country, India, has an oral tradition where knowledge is passed on from the guru to his disciple, and it goes on and on. And I'm quite sure this must have happened many years ago. It will be impossible to say how many. But this oral tradition became visible streams in the Buddhist period, which joined together, more or less, to culminate in a structured text called the Charaka Samhita and the Susruta Samhita. The reason why I particularly brought Ayurveda into this talk is that it is perhaps the first holistic approach to medicine. According to the philosophy of Ayurveda, as is seen in the Charaka Samhita, and that's the basis of the Charaka Samhita, disease is equated to suffering, and contentment is health. And that suffering can occur in the body, in the mind, and in the soul or in the spirit. The holistic approach was that man was just a small microsome in this universe. He was part of nature, and he was interdependent on all other living things in the world. This holistic approach, combined with the holistic attitude that it is the body, the mind, and the spiritual aspects of man which interact with each other and also interact with the environment, that makes Ayurveda one of the most remarkable sciences and art in healing in that epoch and in that age. So, my friends, remember that medicine is not just looking after individual organ systems. It embraces a far more holistic attitude where you look after the body as a whole, the man as a whole, not the body as a whole, but the man as a whole. Each individual being a unique person, man or woman. Obviously, it is one who is familiar with the history of medicine who is better equipped to do so. And if he does really do so, I think he adds wisdom to his knowledge, art to his science, and perhaps humility to his prowess. You must remember that acquaintance with or a knowledge of the history of medicine also helps the character of an individual, because it should inspire him. He sees the feats, the achievements, the discoveries of the great men in medicine, and that should inspire him. And that would also help him to emulate modesty, which so many of these great men had. And modesty, which is really the hallmark of so many great men. It's important to know the history of medicine because it is important not only to know the advances and the progress that medicine has made, but also its pitfalls, its follies, its mistakes. For if you do that, it arouses in the student of medicine the ability to question what he reads. It arouses a spirit of inquiry, wanting to know a little more, perhaps make his own observations. make his own small or big discoveries that advance the frontiers of medicine. William Osler, who is my idol, and who was indeed a great, great physician in the 20th century, I wish to quote him here. This is what he said. Learn to see, to hear, to feel, to smell, and know that it is only by practice that you will be experienced enough. And he said this, medicine is learned at the bedside. Let not your conception of disease be based on what you hear in the lecture hall or what you read in the book. See again, think, and then compare. I think these are indeed worthy words. I want to now go and give you a brief account of what you learn from the histories of medicine. What are the teaching points in the history of medicine? Before I do that, as an aside, I would like you to know that the 5th and 6th century before Christ were indeed great epochs in the history of man. It was at that time that the Buddha preached Buddhism, that Mahavir preached Jainism, that Isaiah preached Judaism. It was believed at one time that Zoroaster preached his monotheistic faith, the first monotheistic religion, but now it is felt that this particular religion was taught even earlier, 1000 BC. It was in these 2 centuries that philosophy flourished the best in Greece. It was in these 2 centuries that Confucius taught in China and Lao Tse taught in China. Great religions and great philosophy were born into the world. Now let us go and see what the teaching points, what does the history of medicine teach? To me, first of all, it teaches that there are limits to medicine. Every age from the past particularly thought that it knew all that it was to be known. But that was not true. Even our age, though we seem to know a lot, we have, even today, with all our modern bioscience, have limits to medicine. And medicine has been so hyped by the media that the people feel that they can have anything and get well from anything with modern medicine. But that is not true. And some of the frustrations that arise amongst the lay people today in relation to medicine is because medicine cannot deliver or meet the expectations of the lay people. So that's the first point. The second point that I learned, that there is no such thing as the absolute truth. Truth is relative. Many concepts, many ideas, which were at one time thought to be sanctified as absolute truth, have been shown to be wrong and faulty. Unquestionably, many of the concepts that we think today are really good, that many of us feel so proud of, may perhaps 50 or 100 years down the line be proved as half-truths, false, or even harmful to men. What does that teach us? It teaches us to be a little humble and to tolerate views of individuals and colleagues who think differently. That's important. Not to be dogmatic, because it is possible that a view which is completely different from yours, a view which is contrary to what is accepted in a present age, might not be right, and a contrary view might ultimately perhaps prevail. The next thing that I learned was that the history of medicine, like the history of civilizations and the history of man, is a chronicle of change. If that had not been so, medicine's civilizations would have been fossilized a long while ago. It tells me that perhaps 100 years down the line, people will be practicing medicine which we would not be able to recognize at all. Just as those perhaps in, say, the 17th or even the 18th or even the 19th century would not be able to recognize the medicine that we practice today. Now, I well remember when I used to take my rounds at the JJ Hospital, people from all three colleges used to come on my Wednesday rounds. And I remember very vividly a bright young girl who had topped her exams asking me, when I used to try and teach a little history of medicine on my rounds, what is the use of learning all this of the past? How does it interest us? I want to learn something of what is happening now. But ladies and gentlemen, please remember that you can never understand the past, or rather you can never understand the present if you are not aware of the past. I'd love to quote the lines of one of my favorite modern poets, Eliot, when he said, "Time present is contained in time past and time future contained in time past." Beautiful lines which sums it up aptly. I would like to tell myself, wouldn't the knowledge of history outside medicine be helpful to medical students, doctors? I think so. Because I think history embraces, in fact, all the other humanities. Arnold Toynbee, one of the greatest historians, contemporary historians, he's not alive anymore, defined history as a study of civilizations. He also defined history as a study of mankind and all factors that affect mankind in a particular epoch. I would like to tell you that more than any other field of human endeavor, medicine is the profession which has been influenced and affected by the most numerous factors. It has been influenced by philosophy, by religion, by economics, by politics, by sociology, by art and culture, geography, by conflicts, by wars, by the rise and fall of mighty civilizations. And therefore you can understand that every aspect which affects all these factors is important if you want to know what medicine is all about. For these factors will continue to influence medicine now as also in the future. I would like perhaps just to give a brief idea of the general humanities. Why is general humanities important? I'm just not history, ethics. Why not? What about the general humanities? It is important because humanities, I think, develops in the physician an aesthetic sense. An inner feeling of goodness. A sense and sensibility that shapes his conduct. An awareness, an acute awareness of the influence of the mind on human behavior, of the mind on the mind and body complex. I think it also perhaps increases one's analytical and observational skills. But above all, I think it inculcates ethical and moral values which would stand by the physician in a fast-changing world where moral and ethical values have fallen steeply. I think humanities also give you a good idea of the intrinsic human nature, its resilience, its bravery. Humanities breed compassion, care, humanity. What is humanism and humanity in medicine? It is the sensibility that enables a physician to care for his patient, to heal him if possible, or at least relieve, mitigate his sufferings. That is what humanity is all about. They perhaps tell you that your work is not just a profession, but it is a calling. Literature, poetry, philosophy, religion also give you a first-rate, in-depth idea of what human suffering is like. How suffering can rip apart the mind, the body, and the spirit, and yet how suffering can sometimes be borne with stoicism and calm philosophy. Importantly, and this is what has interested me recently a great deal, literature, philosophy, and religion can also tell you how at times suffering can spark the creative genius in people who are really talented, so that the world becomes a richer and a more beautiful place, paradoxically, at the expense of the suffering of such people. I can perhaps summarize everything that I have said by stating that the humanities humanize medicine. I think modern biomedicine is not capable of really producing caring doctors or providing a caring health system for that matter. I think humanities has a cohesive force binding medicine in the face of splintering tendencies of an ever increasingly specialized world. Ladies and gentlemen, I should end by saying that the study of all humanities or some humanities, I'm particularly fond of history and literature and poetry and philosophy, has an ennobling effect on the art, science, and profession of medicine, just as it has an ennobling effect on the profession of law and has an ennobling effect on all professions. It is as if humanities can spread a wide net over all humankind, making all people feel as one and increasing the concern of one for the other. I'm reminded of the lines of a great poet, many, many years ago. I'm not quite sure which year he wrote, but sometime, I think in the 16th century or so. Beautiful lines which you can never forget when he writes, "Every man's death diminishes me, for I am involved in mankind. Therefore send not to know for whom the bell tolls. It tolls for thee." Thank you.